we have been on the news a little bit too often this past year with some of the disasters that we've had. And we know that it creates some special concerns with people with diabetes. So we thought it would be an appropriate topic to talk about today. Specifically in Kentucky, what we had happen this year was we had 3 huge events. We had a odd winter tornado breakout event, and we had towns that were completely obliterated. And if you're looking at the pictures, those aren't just Google pictures of any sort of tornadic event. Those are actually from the towns in Kentucky when they happened. One small town in western Kentucky was almost completely blown off the face of the earth, if you will, where I think less than 10% of the buildings were left standing. Then about 6 weeks later, unfortunately, we had a blizzard and ice storm in our state, and we consider ourselves more southern than northern as a state, but sometimes the weather gets confused in Kentucky since we're in the middle of the country. And we ended up having a terrible ice and snowstorm where we had about 10 to 15 inches of snow in one day over the state. It happened like right after lunch, and it essentially shut down all interstates and most state highways. And then to follow that in the spring, as well as a second round in the summer, we had some torrential rains that hit our state, and we had flooding in many areas. And that's a picture of just one of the towns in Kentucky that got flooded out. And we are still in a recovery mode for many of those communities that I've discussed as people are slowly putting their lives back together. Now, of course, ever since we were young, we were taught that everybody should have an emergency box of supplies in case the lights go out or disaster strikes. However, when you have diabetes, there's a few more things to take into consideration to put in your box. And we do want the box or the bag to, of course, be a waterproof one. Some extra things that a person with diabetes may want to have in their storage box are a written list of their current medications. And this sometimes takes reminders, if maybe that you did that last year, but perhaps the list has changed over time. So if you have a smartphone, I tell my patients very often to just do like a quarterly reminder on their phone to make sure that they have updated their list of medications in a paper form. So if they needed to have it in case electronics failed, they would have the most current list. And that can be helpful for other reasons as well. In addition to that, again, having paper items of phone numbers and addresses of doctors and emergency contacts. And most of us do use our smartphones for that. But again, in times where you couldn't charge your phone or you're separated from your phone, that information may not be quickly recalled by your mind. So having that information in the box would also be helpful, as well as a copy of any insurance cards. And this one is a very common one, and this happened quite a few times to some of our patients this year, is pump orders and settings. Some individuals had to transition off their pump due to some of these disasters and back on to insulin, and they could not remember their old orders when they were back on syringe and vials. So having those written down would be very helpful, as well as having some extra paper and a pencil in the box in case changes are made short term, maybe calling into the doctor to get a temporary insulin prescription or temporary management changes so that you can have the ability to write that down and keep up with it. In addition to the regular emergency supplies, we would advocate having a sharps container, extra pump supplies, hand sanitizer, a first aid kit, batteries for medical devices, and charge bricks. Baggies can be helpful they could be waterproof to put electronics in. Sharpies to write things down with. Even when the weather is cold and damp, Sharpies generally still will work. Having an emergency space blanket to keep warm, and of course sanitizing and hygiene items. Obviously, food and water is essential for life. And when you have diabetes, your medication and meal timing is very important. So even during disasters or during times where you may have lost electricity or water, you may have to go to plan B. The suggestion from lots of agencies is to have at least 3 days worth of food and water per person available as a backup in case you are isolated from resources, either for utility issues, illness, or road access. In addition, you would also want to keep low blood sugar treatments available more than usual, just because meals may be quite off schedule and activity may be changing during these times. So having more than usual would be also worth having in your box. Some shelf life stable meal supplies are also encouraged. Some items are listed here for you as well, such as having some canned meat sources, nut butters, nutrition bars, dried or canned fruit, different types of crackers, dry cereal, powdered milk or shelf stable milk are also handy to have on hand. It's also extra nice when you are able to prepare some foods, maybe the electricity's out and you happen to have a little camp stove. It's also convenient if you can't wash dishes to have paper plates and cutlery available, and to have some place to store food, such as a cooler with freezer bricks, and also to have a manual can opener if you are keeping some canned items in your emergency box. If you have, children in the family, you may also, of course, want to consider having extra infant formula and diapers, especially if your infant has diabetes, because you may not be able to get to the store for extra supplies. Hygiene items are also needed in higher amounts when you have kids. And if the child has any special food concerns or restrictions or sensitivities, taking into account that the food in the box would meet their needs. And we can't forget about our pets, whether our pets have diabetes or not. Same thing applies to them. You would want to make sure that you have extra food and water to meet their needs. I know we're talking a lot about these terrible disasters that happen, but being prepared also means planning for needs such as like having COVID or the flu. In those situations, you may not feel well enough to do normal activities or eat normally. And these times, it would be helpful to have a 6-day shelf also to have available, and having a mix of both sugar containing and non-sugar containing items. Because during these times, blood sugars may vary. They might be too high at times or too low at times. So you may need to switch out depending on what your blood sugar is, of whether or not you sip sugar-free liquids or sugar-containing liquids to help moderate your blood sugar. In those times, it may be helpful, instead of planning meals, just to practice grazing, eating every couple of hours, and of course, monitoring blood sugars more often. And if you have type 1 diabetes, making sure you have ample supply of ketone strips, and notifying the provider if you have any positive ketones. Here's some just additional final issues related to disasters and diabetes care. Stress, of course, will cause blood sugars to go higher than normal in a lot of folks. So keeping that in mind and seeking out resources for help. Dehydration may also cause increased blood sugar, so it's important to make sure you have ample water. And it's important to recognize that food of any kind is better than going hungry when you're a person with diabetes. There was a story in Eastern Kentucky of a woman who was involved in a flood, and she actually was, there was a story about how she was concerned about eating maybe some of her less common items that were available for free from the rescue and support people that were showing up in her town. But what she learned was that eating anything was better than nothing, because you can get back on track at some future date. But they also acknowledged that that is something for communities to consider when supplying emergency food to communities, is to consider some healthy options for those individuals who may have special dietary needs. And then finally, making sure that you communicate with others by identifying yourself as having a medical concern, such as wearing medical ID or carrying a medical ID card. In talking about medications, I'm going to now turn it over to Elaine Carson to continue our discussion.
Okay, I was going to share first, this is a sample kind of a sample plan. Are you able to see my screen now?
Not yet.
Okay. Wait for it. I thought it was going to happen here. Let's see. Apologize. No, it's not sharing. Hold on. Doesn't seem to be popping up, does it?
Would you like?
Okay. Yeah. How about you? Would you just click on continue the screens then?
Yes, I can.
Okay. Thank you. I think I might have lost control when I had to switch devices. So I have here a sample. First, I thought I'd just share a quick sample that Kathleen had shared with us, and this is what they use in their clinic. So it's a nice comprehensive plan that will kind of a good checklist to go with. Okay, go ahead to the next. And if you want to go online to download a resource, I did find some other documents online as well with the diabetes disaster, what is it? The diabetes, disaster response coalition, and the CDC has plans as well, a lot of other details. And I put on here the plan from the American Association of Clinical Endocrinologists as well. And you can see that's kind of endorsed by multiple drug companies. And so these are some other places you can go for plans and helping patients prepare or helping your loved ones prepare. Go ahead to the next slide, please. And this is the American Diabetes Association site. This, I'll point out multiple, I went ahead and highlighted multiple spots on here to take a look at the tools and support tab, where there are resources for figuring out what to do if you need to switch insulin products. Also tips on knowing how the insulin should be stored, finding a pharmacy if you need additional resources, and also a link for a plan. So all these things are key when you consider that the sensitivity of the insulin and needing to be, when it's before it's open, it's supposed to be kept to 36 to 46 degrees, and really don't want it to be in direct light or greater than 86 degrees. So there are all these things to consider and complications that can occur when you don't have power, or you saw the pictures on the slide that Kathleen showed. So if you find yourself in a disaster, there are resources out there to help figure out, can this insulin still be utilized, and I guess just recommendations around never using frozen insulin, or how you might need to alter a dose if you are switching the type. Furthermore, when you're thinking about the pills or the other medications that a patient may be on, they need to have in part of their plan, knowing what can be done, what might be able to be rationed versus some pills can't even be cut in half. So it's important for the patient to know what they're taking, the directions, and what they might need to do if there's an emergency situation. And even in normal times, we can run into glitches. I think we've all encountered so many supply chain problems in the past year or two that we never imagined. So unfortunately, medications may be no different. So as the panelists discussed earlier, we can run into issues in simply the process of receiving medication and supplies, but also there can be other complications and delays in shipping. So it's important to try to keep at least a week worth of medication on hand at any time, and to know where you can go if you run out. go ahead and go to the next slide, please. And I thought I'd kind of wrap it up with this about how it's critical to have a plan for the emergency situations, but even when being over prepared can help when ordinary illnesses hit you. And we're getting into flu season. COVID is still out there, and these ordinary illnesses can cause serious problems for people with diabetes. So it's important to have a plan and reducing the risk and stress so that they can manage and maintain health in times of crisis. So this is from the ADA website as well, just kind of the tips. And I think that there are a lot of really good resources linked to that last page that I had shared with you. So I think continuing to focus on, trying to stay well and practice all the good hygiene behaviors that we know are important. Staying home when you're sick and getting help when you need it that's the key in a nutshell. Do you have anything else to add, Kathleen?
No, I agree with you. I think having the payers understand that sometimes patients need a little bit more than just exact refills for having a little backup supply is a very important point you made.
I think recently, when with the hurricane Ian, I had heard, that from the drug company standpoint that, they had reinforced the need for patients to be able to get refills early and, trying to push that to the insurance companies as well because of the crisis that patients could be in without medication. So it's important. Sure, appreciate your time. Does anyone have any questions? I think we're wrapping up the breakout session. We're going to be redirected.